and welcome. You're watching Head to Head. I'm Antonina Antosha with UATV. About 25 million Ukrainians have already signed declarations with family doctors as part of the Ukrainian healthcare system reform. The second stage of the reform is medical services by specialized doctors as well as emergency medical care. This stage will be launched this year. So what changes shall Ukrainians expect in the healthcare sector? To tell us all the details, we welcome to the studio today Yevhen Kuzyk. He's a coordinator of Ukrainian Primary Healthcare Association. Hello, and thank you for joining us.
Hello.
So first of all, let's talk about the results following the implementation of the first stage of the reform in the healthcare sector. First of all, following the formula, money follows the patient, Ukrainian citizens had to sign a declaration or a contract with a family doctor or a pediatrician. How many Ukrainians did actually sign?
First of all, I want to thank you for inviting me to this program.
The pleasure is all ours.
Thank you. Approximately 27 million people already signed the declaration.
So more than a half.
And I want to say that no one in 25 years in Ukraine had ever risked to reform the medicine in Ukraine. And the topic of medical reform in Ukraine is very relevant. Why? Because according to the Ministry of Regional Development in Ukraine, and the situation in healthcare system in villages in Ukraine in January was really terrible. Just imagine two numbers. First number, only 28% of these establishments, like institutions, where have water supply. 1/3 of which is wells. Can you imagine? This is like 21st century, and this is the biggest country in the Europe. And second number, only 18% have bathrooms. Also Europe, and doctors, of course, do not want to go there to work, because rural medicine was founded by the residual principle.
Wait, this is the second stage we're talking about, the reform in the healthcare establishments. Let's come back to the first stage and to the declaration
signing. We are talking also about the first stage.
What I wanted to clarify is that Ukrainian citizens were recommended to sign the agreements with the family doctors until April 1st. And there has been information appearing that those of us who had not or who wouldn't have signed the declaration or the contract with the family doctor would face some kind of restrictions after April 1st. What kind of restrictions are we talking about?
No, if you don't sign the declaration with your family doctor, you can do this like after 1st of April. It's not the end of the health, and you can do everything. Of course, you will, the medical doctor, the family doctor will give you all that he can give to all other patients. If you need help, you will take this help from the medical doctor. This is not the end. But if we are talking about the money, they are following the patients, and of course they will follow those patients that signed those declarations. And if we are talking about clearly medical system in Ukraine, of course we need to call and to ask our citizens to write this declaration, because without these declarations, the state will not give the money.
Another novelty that is already implemented or is soon to be implemented is an electronic medical card. Now, how does this medical card connect the patient, the doctor, or the family pediatrician and the state?
Yes.
How does it work?
It does its work. It's really good, new for us, and this electronic card is working right now. But
so
it's working in testing regime, because in Ukraine we didn't use this before. We always was using paper
and a pen.
Yes, and for us this is something new. Data will be provided of the Premier Link using the international classification ICPC2. and this is all countries, like not all, but a lot of countries in the world are using this classification, and this is also very important thing for us, because all important information that is signed or is available for a medical doctor, he will put all this information to the computer and to
So basically it's a dossier of a doctor, or
Yes.
what kind of important information is going to be put in that electronic medical card?
Diagnosis, appointment of treatment, referral for additional examination, reason for treatment, like everything, and consultation. Like if you came to a medical doctor, if a family doctor, if you had some consultation, everything after this consultation would be inside of this in program. And if you need to take some medicine, you will have like electronic receipt, and with this receipt you will go to the aptic, and you will take the medicine for, like, also for free, because in Ukraine, as you know, we have the program available medication.
That's what I wanted to ask within my next question. Starting April 1st, a program called Available Medicine is going to be launched. What's this program about, and who exactly is going to benefit?
Exactly, all people can be inside in this program. First of all, you need to go to your family doctor and or therapist or pediatrician, and with whom you signed the declaration. After, doctors make the reception and also prescribes prescription. And also the doctor is supposed to check your mobile phone, because on your mobile phone you will receive unique number and confirmation code, and with this code you can go and to take for free the drugs that you need. And this is new for all Ukrainians.
Okay.
And over 33 million recipes were written over 1.7 billion hryvnias in 2 years.
Okay. What about the free diagnostics program? What's this novelty all about?
Main idea of medical healthcare system is a fee for the services and not the payment of the infrastructure. And you understand, and all people, of course, understand. And including guaranteed package of primary healthcare services includes the following tests. This is general blood test with the leukocyte formula, general urine analysis, blood glucose, total cholesterol, fast pregnancy test, rapid test of EHV, and from July 1st this year, the government will introduce also more 54 free analysis and studies to refer your doctor. This is 20 analysis, 6 types of ultrasound, 4 types of biopsy, mammography, and some kind of operation of 1 day.
And those services are going to be what, free of charge, or they are going to be needed to pay for?
If you want, like, you can choose every medicine. If you want to have Ukrainian medicine, you can get this for free.
I'm not talking about medicine. I'm talking about the process of getting a diagnosis.
Of course, this diagnosis would be for free for all citizens that already signed the declaration with the family doctor. And if a family doctor understands that he need to see more information about you, that he need to have some tests, like you're supposed to take those tests, of course, he will sign this, and with this receipt, you're going and you're taking this test for free from 1st July in this year.
Okay. What about the private medical institutions? Because we have a number of those, well, at least in the Ukrainian capital. We have a number, we even have the chains of private medical institutions. What's going to happen to them?
Also, if you are a citizen in Ukraine, you can also choose the family doctors that are working in private healthcare medicine. You can choose those doctors, but sometimes you have to pay a little bit more for this, that you don't stay in the line, and for the reasons that you don't stay in the line, and also that maybe this clinic is closer to you, or there is a little bit higher quality of medical healthcare.
Okay, let's be simple here. I am a Ukrainian citizen.
Yes.
I don't have a declaration with a family doctor. Instead, I go and get my healthcare services done at one of the private clinics that is not far from my house.
And state will also pay for this private clinic for you, because
if I sign the declaration with one of the doctors working for the private clinic.
Yes,
okay.
But you will have only this 50 free analysis, and more if you want to have, of course you will pay. And also, like, this private clinic will give the higher price of another analysis, or from like the price would be higher. That's why it's interesting for those doctors to don't take money from you, and this is very interesting to take money from the state.
This is just basically the first stage of the healthcare reform. When the total implementation of the healthcare reform is expected to take place in Ukraine?
We hope, of course, that in 2020 we will reform also not only primary healthcare system, also like second level and third level, because now the government, I know that they are thinking about how much is supposed to cost any like operations, any another studies, and they supposed to understand how much the whole system costs for like people. And after all of this mathematics, after all of these numbers, when we conclude, we will hope that we'll have insurance medicine in Ukraine.
Well, hopefully that's going to happen as soon as possible. Thank you so much for coming and clarifying the whole situation for us.
Thank you.
That was Yevhen Kuzyk. He's a coordinator of Ukrainian Primary Healthcare Association. Thank you so much for watching UATV, and stay tuned for more.